Welcome back, learner. So today we will be discussing in this video microscopic examination of urine. So you know that the reason behind is that microscopic examination doesn't mean just it is only the microorganisms which we are trying to isolate from the urine sample, but microscopic examination comprises of various cellular debris from the urine sample. Apart from it, the microorganism. You know that urine is sterile. So if there is microorganisms in the urine, that means it is an indication of certain type of infection in your excretory system. So that is called as your microscopic examination of your urine. So what you do is that first is you do first morning voiding. So in the very first morning you do the voiding of your urine. Why we will try to do void at morning? Because it is most concentrated at that time. Okay, so the morning sample is considered best that it has higher specific gravity and lower pH. So you can say, I can write over here, it is having higher specific gravity and your lower pH. So that is very important. So then we have to record the collection time. So record the collection time. Okay. So you record the collection time. Use clean, dry and wide mouth container. So you take a container which is clean, dry and white mouth, and of course it has to be sterile. So it has to be sterile container. Analyze within 1 hour of collection. So then what you do is that you analyze within 1 hour of collection. Okay. Free of debris or vaginal secretion. So the urine which will be there should be free of debris. So it's a straw colored urine which is being collected into the vessel, and it should be free of debris. So free of debris. Okay. So next is the purpose of urine analysis, which I have talked about. Again, I will say that general evaluation of health. General evaluation of health. Okay. Then diagnosis of metabolic or systemic disease that affect kidney function. So there is a problem in the kidney. So there is a problem in the kidney. So there is a problem in the kidney. So there is a problem in kidney function, and that kidney function problem is because of metabolic or systemic disease. Metabolic or systemic, or systemic disease. Okay. So diagnosis of endocrine disorder, 24-hour urine studies are often ordered for this test, and diagnosis of disease or disorders of the kidney or urinary tract has to be there. So you know, so diagnosis of endocrine disorder can be done. Okay. Diagnosis of disorders of the kidney and urinary tract. Monitoring of patient with diabetes, that is very important. Okay. Testing for pregnancy and your drug abuse. So many things can be determined by your urine analysis. Okay. So composition of a normal urine. So if I start with the composition of the normal urine, so the volume of the urine is 600 to 2400 ml per 24 hours. So average is 1200, right? Specific gravity, it is your 1.003 to 1.030. Then reactions. So reaction is your acidic, okay, pH is your 4.7 to 7.5, and average pH is of, so average pH is of 6.0. Then total solids are 30 to 70 gram per liter. So total solids, that is your 30 to 70 gram per liter. So this is all about your composition of your normal urine. So there are also certain inorganic composition, inorganic constituent of the urine comprising of iron, chlorines, sodium, phosphate, sulfur, okay, calcium. So all these things are there, and there is a particular concentration of it. So of course I shall give you the information that is very important. Iron 0.06 to 0.1 mg. Okay. Then chloride 9 to 16 gram. Then sodium 3 to 4 gram. Phosphate 1.5 to 2 gram. Sulfur 0.7 to 3.5 gram. Calcium 0.1 to 0.3 gram. So these are the contents of your inorganic part of your urine. Now the organic part of your urine is your nitrogenous compound 25 to 35 gram. Urea 15 to 30 gram. Creatine 0.60 to 150 milligram. Ammonia 0.3 to 1 gram. Uric acid 0.3 to 1 gram. Protein 0 to 0.1 gram. Now you know that when we talk of your preservation, all the specimen of the routine urine analysis should be examined while fresh, within 1 hour of collection. When urine is kept for longer than 1 hour before analysis, to avoid deterioration of chemicals and cellular material and to prevent multiplication of bacteria, it should be stored 2 to 8 degrees C in refrigerator. So if you can store, it's okay, 2 to 8 degrees C in refrigerator, but better you don't store, because that will result in the generation of your bacteria. Okay. So the expected change in the composition of urine stored at room temperature, it may be the lysis of the red blood cells by hypotonic urine, decomposition of casts, bacterial multiplication. So there may be casts. Okay. Then there may be bacterial multiplication. Okay. Then decrease in glucose level due to bacterial growth. So decrease in glucose level. So the glucose level is decreased due to bacterial growth. Okay. Formation of ammonia from urea by the action of bacteria. So formation of ammonia. So ammonia from urea by the action of bacteria. So by the action of bacteria. Okay. So these are the points. So next is, you can use various types of preservatives like toluene, formalin, thymol, chloroform, commercial preservatives, etc. So next comes the type of analysis. Okay. So the type of analysis, type of urine analysis. So first is your physical analysis, okay. Then is your chemical analysis, then is your microscopic examination, okay. Then is your culture, then is your cytological examination. So physical analysis, chemical analysis, microscopic examination, culture and cytological examination. So physical analysis basically comprises of volume, color, appearance and your odor, okay. Then so volume, so you understand, you know the specific volume, standard volume, so you actually compare with that particular volume. You know that it is 1200 to 1500 ml, so the normal range for 24 hours. So urine may be from 600 to 2000 ml, so you have to understand it, you have to compare it. Then comes the color, the color of normal urine. So if I talk of your color of normal urine, what is the color of normal urine? It is yellow to dark amber. So it is yellow to dark amber. Very pale or colorless urine can result from high fluid consumption, diuretic drugs, natural diuretics such as alcohol and coffee and so on, and also sometimes diabetes insipidus and diabetes mellitus. So that can change the color of the urine. Appearance, normal urine is usually clear. Urine may appear cloudy or turbid. So if the urine appears cloudy and your turbid, so if it appears cloudy and turbid, so what can be your interpretation? Your interpretation will be that it is because of the leukocyte and epithelial cells. So presence of leukocytes and your epithelial cells. So that is very important, right? Bacteria can also cause colorless cloudiness urine. So it also causes cloudiness urine. Am I clear? So you know that fat and chyle give urine a milky color. Presence of RBC may give urine turbid and smoky appearance. Now the routine urine analysis also goes for the testing of some of the important compounds, that is your proteins, glucose, ketone bodies, okay, occult blood, very important, occult blood, okay, bile pigment, bile salts, urobilinogen. So all these things are taken into account. So you know that then I will move on to the microscopic examination of the urine. So if we talk of your microscopic examination of the urine, the general consideration is that the microscopic examination is a valuable diagnostic test for the detection and evaluation of renal and urinary tract disorder, which I have talked at the very beginning. And microscopic elements present in urine are collected in the form of deposit by centrifugation. So what is happening? You are taking the urine and you are centrifuging, or centrifugation is being done, okay, to find out the debris. So you take the debris, you put it into the slide, sediment into the slide, and you see it in your microscope. So that can be done for the debris and other routine analysis of your microscopic analysis of your urine, okay. So with this I complete my class today. So I will be also giving you another video lecture on the remaining part of the microscopic analysis of your urine, because we require to understand that what type of cells and what type of microorganisms are basically present in the urine.